Good morning. My name is Phoebe Montalvo. I am a registered nurse at Scripps Hospital in Encinitas, California. I have a question for you today. How would you feel if your loved one came home from the hospital with this on their body? This is an image retrieved from the National Pressure Advisory Panel in 2016, which shows a stage 3 pressure ulcer that a patient developed during an inpatient hospital admission. I would have to say I would be pretty disturbed if my loved one came home with this. The specific purpose of my presentation today is to inform you, because you are a healthcare provider, on the proper way to prevent pressure ulcers and the reasons for doing so. I will provide you with an evidence-based guide to the prevention of pressure ulcers in the clinical setting. It is important to recognize that failure to provide adequate prevention places the provider at a liability, and prevention is a cost-effective approach that positively impacts the patient's health status while in a hospital. The significance of this video is to help decrease healthcare costs and increase patient safety. Pressure ulcers are one of the most commonly acquired hospital-related conditions, but are easily preventable, as discussed in research by Berlowitz in his 2016 article titled Epidemiology, Pathology, and Risk Assessment of Pressure Ulcers. As I mentioned earlier, I have two main points to discuss today. The first being that pressure ulcer prevention is a cost-effective approach to positively impacting the inpatient health status. The second being that failure for the healthcare provider to implement safe pressure ulcer prevention may place the provider and hospital for a liability. Let's talk about point number one. It is the nurse's responsibility to evaluate each patient for the risk of developing a pressure ulcer. The risk assessment should include a detailed medical history and physical exam, which includes a thorough skin assessment, paying close attention to the sites which are at high risk for developing pressure ulcers. As you can see, this is an easy visual created by the Salisbury Foundation website titled Pressure Ulcer Prevention. If you take one thing away from this presentation, it should be that pressure redistribution is the most important factor in prevention of ulcers for our patient. This is indicated by Berlowitz in 2016 on the website uptodate.com. Again, let's visit this visual. This was created by the Salisbury Foundation in 2016 and indicates high-risk areas for development of pressure sores while your patient is laying in bed. Some of the areas that we should pay close attention to are the back of the head, the shoulders, elbows, the buttocks, the heels, the ears, thighs, and leg areas. Even when your patient is sitting upright in bed, they are still at increased risk. Again, the buttocks and the back of the spine are some of the areas we need to focus our attention to. Pressure redistribution may be achieved with the use of supportive devices. For example, specialty mattresses like an air mattress, an overlay on your mattress, or etc. Air mattresses are especially helpful in patients that don't have the assistive ability to reposition themselves in bed. The mattress has the ability to redistribute the weight of the patient while the patient is in bed. Repositioning is another very important tool. Repositioning should be performed about every 2 hours with the goal to reduce pressure and increase circulation to the high-risk areas. Again, the high-risk areas being these bony prominences that the patients are exposing themselves to while in bed, like the heels, the shoulders, and the buttock areas. Let's move on to my second point. Failure to implement pressure ulcer prevention places the provider and hospital at a liability. Research from Berlowitz indicates that hospitals will no longer receive additional payments when patients develop stage 3 or stage 4 pressure ulcers from Medicare or Medicaid. In addition, when an ulcer does occur, problems contributing to its development should be identified and methods for solving these problems implemented. This visual indicates ways that you can place your patient's positions in bed with use of pillows behind the patient or underneath the patient. in order to increase circulation and prevent creation of pressure ulcers. This visual was created by Craig Hospital and can be seen on their website, titled Padding Indications. According to the article Pressure Ulcer Prevention on UpToDate.com, implementation of ulcer prevention should be a quality initiative at every hospital. Initiatives may include staff training, skin teams, audits and checks, and education for best practices. In conclusion, it is important for all healthcare providers to know their responsibility and the impact of pressure ulcer prevention. Please use the tools presented to you today in this video to help prevent this easily preventable occurrence. Your patients and their family members will appreciate it. And don't forget, it is everyone's responsibility. And by a hands-on experience teaching environment with your patients and family, they too can be involved in safe care and prevention. Thank you very much.